Well, here we are with Dr. Davidhizar from Alaska, who has a private practice. I think it's kind of like a family practice, Dr. Davidhizar. But why don't you tell us what, your practice, what services your practice provide, which type of patients for which type of symptoms or illnesses they should actually come to you?
Well, we're family practice, so we cover the whole gamut of medicine. Some of the more complicated procedures we don't do in our office, but we cover internal medicine, obstetrics. Well, I quit doing obstetrics, but we do the gynecological part of it. Pediatrics. We do a lot of preventive medicine, which is a thing that we're interested in. We're trying to prevent people from getting sick, if possible. So we do a lot of lab testing, try to determine what problems they have before it becomes serious. And so we do a lot of diabetes, high blood pressure, vascular disease. We also do a lot of back pain problems, since I'm an osteopathic physician. And we do pain intervention with injections to help reduce people's pain so they don't have to take pain pills, and try to get them back to work again. So we do pretty much everything. We're sort of the last frontier here. So there's really not anything we don't cover.
Okay. Well, let me ask you, Dr. Davidhizar, you said that people with a back pain, and you give them injections so they don't have to take pain medicine. Wouldn't an injection be pain medicine, or are you talking about something else you're injecting here?
Right. We're talking about injecting like the joints or the back. We do epidural injections with steroids, and that frequently helps people get rid of the leg pain and the problems they have with ruptured discs or just degenerative disc disease of their back.
I see. So those are more type of injections, which is your experience that on the long run, the symptom of the pain gets more handled and maybe not cured, but handled rather than with pain medicine like morphine, just to make an example, where the pain gets masked, but the problem still stays there, even though the pain isn't there. So is the injections you're giving actually working on healing the problem?
Yes, it does. Frequently the pain completely goes away. We had a patient just the other day that said, I injected them 2 years ago, they still are doing fine.
Wow. That's obviously a wonderful thing. Well, wonderful. And you said you also, you do see children and you take care of children. Yes. Did I get that right?
Yes.
Okay. Wonderful. Okay, well, thanks a lot, and we'll be talking more about some specific symptoms and illnesses with you, but thanks for kind of informing us of, what it is you're doing. And by the way, what exactly does your title DO mean versus an MD? What's the difference there for some of us who don't know?
Well, the DO is a doctor of osteopathy. We do things that the MDs don't do. We still go to medical school the same amount of time. We had to do a residency. Actually, my residency that I did was a MD residency. But we do more things with musculoskeletal problems such as back pain and joint pain and those sorts of things. That's more of our specialty. We do manipulation, different than what chiropractors do, but it's sort of similar. We've had great results with that. So it sort of sets us a little bit apart from the MDs. But, DOs do surgery and all the other things that MDs do. We just do a few extra things as well.
Oh, I see. All right, good. Well, again, that's good to know that you get the whole package of an MD, but at the same time you seem to have a higher specialization in joint pain, knee pain, back pains, and those type of stuff.
Yes.
Well, absolutely wonderful, because one thing I noticed, lots of people in this country and probably in all other countries, because my father has never stepped foot into this country, well, actually did once for a week, they have those type of pains. It just almost seems to be something universal, where if you live long enough, you're for sure going to get it.
Sometimes that's the way it seems.
All right. Well, thanks a lot, and we'll talk more. Bye-bye.
Okay, bye-bye.